So believe it or not, it's now 13 weeks since we started these. So if you've not joined before and you've not met me before, welcome. I'm Sarah, the Chief Exec here at LYPFT, and we've been running these as a way to cover some important trust business, what's happening nationally, and to shine a spotlight on some of the fantastic work that I know is taking place across the organisation. So we run it as a one-way broadcast, but if you do have any specific questions, please use the chat function. And if there's anything you want to ask in between sessions, please just use the coronavirus email inbox, and the team keep their eye on those to see if there's anything that we need to pick up each week. So a huge thank you once again for another week in which colleagues across the organisation and our service users and their carers continue to have to adapt and change the way that we're working. Because the world around us continues to change with the change in lockdown arrangements, but also the change in guidance and what that means for us as an organisation. This week it's also Learning Disability Week, and you'll have seen already, hopefully, some of the information that we've been sharing from our supported living service and our learning disability services through social media, and I'll come on to that a little bit later. And the theme for Learning Disability Week this year is the importance of friendships. Absolutely, friendships are a vital part of what helps keep most of us well. Our friends are a great source of support, companionship, and in particular when we're feeling stressed, worried about things, our family and our friends are our first port of call. And we know that's been harder in lockdown because of, certainly in the early weeks, not being able to have physical contact. And it's especially hard for people with learning disabilities and people that may have particular support needs in terms of communication and being able to access from a friendship point of view. And if you can't do that, then the impact of loneliness and social isolation just compounds the stress that people are already experiencing. So there's a couple of areas to shine a spotlight: the amazing work that our LD services have been doing to continue to support people throughout the lockdown, and also from a regional point of view, through the West Yorkshire and Harrogate collaborative work, which I am the lead for, we've been running a project called Keeping Connected. And this is voluntary and community sector organisations across West Yorkshire have been making telephone contact to people with learning disability and autism who are isolating, that aren't in contact with any services. There are lots of people that live independently, but if you're not in contact with any services, then that can present an even bigger challenge of isolation. We're halfway through, and that's already, the feedback has been really positive. People have been struggling at home on their own and not knowing where to go to access support. And this is all about, as well, the more support we can put in place now, hopefully reduces the risk for some people to go on to develop further exacerbation of the mental health issues, or to develop mental health problems for the first time. And again, that's something I'm going to come on to a little bit later in this week's session. And so what do I say to all of you? Please, you've all got friends, I hope, and make sure that during Friendship Week, it's a good opportunity, if you've not been in contact with people for a while, to pick up the phone and just get in touch and just get that space for yourself. So I wanted to give a big update on testing today. So we've got a big programme running now on antibody testing. At the moment, it's open to staff in the organisation. So a huge thank you. This is a team made up of people redeployed from other roles that are there taking bloods for us, and admin staff that have been redeployed, HR staff. So it's a real team effort to have stood up this service. So they've had over 800 requests so far. So please do email in to the email address there, and you'll find it on the website if you do want an antibody test. I had it on Friday, so I can guarantee it's really quick and really simple, and you've no need to, if you're afraid of needles. They're a very lovely, friendly bunch. So what the antibody testing programme is all about is to find out what proportion of the population have currently had at some point had coronavirus, and you may or may not have had symptoms. And this is all adding to what the national intelligence is coming together to better understand COVID, and therefore support research into how it can be better treated. And what we know from the rates that are coming back across the country, it's really variable, the percentage of people that are coming back positive. I'll not dwell on the fact that mine was a negative result. Personally, I would have rather it have been positive. Roughly what we're seeing is about 10 to 12% of staff that have been tested so far are coming back positive. Whereas elsewhere in the country, down in London, in some trusts, they're reporting that as high as 30%, and over in the northwest, roughly around 20%. One of the things that we said is we'd look at trying sharing our our returns locally, and also to do some breakdown in terms of demographics and key information to better understand that data. You can see there the team are also supporting at Clifton House. I've just seen a question pop up on access to antibody testing for those that are shielding. A great question. We must do what we can to make that available in a way that doesn't put people that are shielding at risk, because at the moment the guidance is to only come out of your house for exercise. However, I'll ask the team to look at ways and means to make sure that you can access the antibody testing as well. So we'll give an update on that next week. The test and trace service continues. So in the first instance, you're more likely to be contacted direct through the test and trace. And if you are, to say that you've been in contact with somebody who was COVID positive, then please, before you go anywhere or go to work, contact HR and your line manager, and then we can arrange for a direct conversation with the infection prevention and control team. Guidance is being produced by the Health Protection Agency specific to different environments, which includes healthcare environments, and that will really help us in terms of giving you the right advice that keeps you and your family and your colleagues safe. Ruth has asked a question about the app. Is that the COVID app you're referring to, which you know as much as I do from the news as to when the app is actually going to be available. We were told it might be available later this month. I think it's the latest I heard. It's going to be several months away. It's optional. It can't be mandated to make you download the app. Your phone is your own personal property. Thankfully, we don't live in a state where those kinds of things get enforced. It will come on the basis of, like we've all been encouraged to do, of please download it in the interest of helping us better manage and control outbreaks, because the aim is to get away from a national approach to isolation guidance, lockdown guidance, so that it can be much more nuanced around local outbreaks. And that's something that the Director of Public Health is working on at the moment, all the Directors of Public Health, on what the outbreak arrangements would be for local communities. So I just wanted to touch on face coverings at work as well. So again, I touched on this last week because we'd had some national guidance announced in one of the ministerial briefings on it becoming mandatory to wear face coverings in health and care settings. And so that applies to us, it applies to our services. Obviously, our clinical services have been using PPE for quite some time now, and I've got a good understanding and are using that really well. So this is a big change if you're not in any of those clinical settings. Please use the face coverings that we are providing for you. You don't need to use your own. We'd rather you used ours. They're available at every site, which is more details are on the website, and we've got waste disposal arrangements in place because obviously what we're providing is single use. And then you can see there's specific guidance to follow. If there's anything you're not sure of, it is all on the Trust website and the intranet site as well. Again, what's really important is if you are able to maintain social distance, keep that 2 metre distance at all times. That's the first level of protection. Frequent washing of your hands. So none of these arrangements, PPE does not mean that you don't need to do the other steps to keep yourself safe from COVID. And so some of the conversation has been, well, if you're in office spaces and you're sat 2 metres apart, why do you need to wear a face mask? Well, if you're going into other areas that are used by other people, and you don't know whether somebody's got COVID because they might not have symptoms, and there's droplets it's about protecting from those, protecting you from producing droplets that then may land on a surface that other people touch. So that's why the hand washing goes hand in hand with the need to wear the masks in those areas. One thing, I don't think I've got it in one of the slides this week, is just to remind people from an inpatient point of view, in our inpatient beds, thanks to the fantastic compliance with infection prevention guidance, the testing programme that we've got in place. We've not got patients at the moment in our inpatient areas with COVID. However, we do still have, and our liaison teams continue to support people in the acute trust with COVID, and in the community, we continue to have to support people in their own homes that have got COVID. So whilst on the one level, the figures are reassuring from an inpatient bed point of view, it's still very much part and parcel of the business of many of our staff, day in, day out. So another area I just wanted to touch on, which I alluded to earlier, is the NHS reset. And as we're in phase 2 and thinking about phase 3 and what winter might bring, there's been a lot of conversations as to what does this mean for planning the predicted demand on mental health and learning disability services going forward. And there are a number of strands to this. One is those that we already provide support to as a consequence of the lockdown, as a consequence of COVID. Just what difference does that make to people needing additional mental health support? For those people that we hadn't seen come forward that would normally get referred to services, when will we start to see that? We're already starting to see that come through in terms of steadily increasing referral rates back into our services, which we're reassured about. We don't want people sat at home suffering and families suffering when we're able to provide a service. And then there's people that have, we know COVID itself from a physical illness point of view can have consequences in terms of people's direct mental health and neurological functioning, especially in severe cases. So we're having conversations with partners about what our role will be from a rehabilitation point of view in supporting those individuals. And we know, I mean, I don't know about you, you turn on the news each day and sadly there's further announcements of redundancies, more people are suffering hardship. The economic impact of COVID is going to be felt for a long period of time. We know that that creates additional distress and ultimately mental health issues for people. So there's work that is already taking place, both from a local system and at a national level, in order to try and predict what the demand is, but we are very clear and welcome of the Confederation's report that there will need to be continued investment in mental health services to meet that demand. We've already been given assurances that the transformation monies that are attached to the long-term plan for mental health are being made available. The money is still there. It's not been consumed by the COVID spend, and we should know by July what allocations are going to be made to increase service provision. And of course, we need to continue with our recruitment efforts because availability of staff will be one of our biggest limiting factors in this. And that's an ongoing conversation that we're contributing to and trying to assess for our own services. So I just wanted to flag to make sure that people are aware of that, and lots of people across the organisation are actively involved. So unlike many people that you see on the telly, I've not spent any time queuing outside of shops since Monday. It wasn't one of the things that was on my to-do list as lockdown increases. Some of you may have done, because in terms of mental health and well-being, shopping, some people find therapeutic and beneficial. And I know from speaking to some people, the children have outgrown all of the clothes during lockdown, so there's an urgent need to go and buy some clothes that now fit the children. But it's a big change this week, isn't it? So shops are reopening, places of worship are reopening, dentists are starting to reopen, other businesses are opening back up, the roads are certainly busier. That in itself, on the one hand, is positive, but it does also mean that there's that increased risk that we might see spread of coronavirus. That's why the work we talked about in terms of local lockdown arrangements are important, so that you can quickly respond to pockets of spread of coronavirus and minimise the disruption to wider communities. In terms of shielding, we are expecting by the end of this month an update to the shielding guidance. At the moment, the guidance is still, if you are identified as somebody who is clinically vulnerable, that you must shield at home and only leave your house once a day, commute with one person from another household. So if you've been able to benefit from that, that's great, but I do know those in the shielding category are finding it tough. And so hopefully the guidance that comes out by the end of this month will give some plan going forward that will help people think about how they're going to be able to cope and going to be able to manage. We do know locally that there's still a really low uptake of people registering that are in that shielding category. So if it's a call out to our services, please encourage service users that you're working with, if they are clinically vulnerable and are shielding, please register. Even if you don't need the food deliveries and the medicines, it maintains that ongoing way of communication and getting that up-to-date guidance. So please do go onto the Leeds website and get registered, or your local government, local authority websites for all other areas. I've talked about the kind of the variability, and this R rate gets referred to as to what that actually means. And I think most people say at a local level, but it doesn't really tell you much in terms of what you need to do differently. And I just wanted to touch again, we are still working hard on enabling staff to return into the workplace, following the guidance that's been set out in terms of COVID secure environments, and that's actively ongoing. I've had some feedback from one of our colleagues in the trust this week. I think we probably need to put some more explicit communication out and share the timeline so that people know whichever base they operate out of, where that work is up to. So again, I'll pick that back up with the team, because I don't think we've got enough information out there so that everybody knows what's going on. Each week I return to have a focused conversation about what we're doing to support our colleagues who are from Black and minority ethnic communities, and we continue to see the same messages coming through of the increased risk of COVID. So not only is that a big impact on our BAME staff, but understandably, and I fully support the focus now we're taking on racism. There's been a lot happening, hasn't there, in the last few weeks in terms of the death of George Floyd, subsequent accounts and media coverage of brutality, further deaths that have been recorded in the US. And it's difficult to watch. It's difficult for me to watch as a white woman. I can't imagine how hard it is for people that are from Black and minority ethnic communities to watch when this has been part of their lived experience for many, most of their lives, seeing played back, something that they've always had to experience. And as I said last week, the solutions to the pandemic of racism sit in all of us. This isn't something that we look at, what is our BAME community going to do about it? What is the white community going to do about it? Actually, we've all got an individual and a collective responsibility, I believe, as human beings first and foremost. And my expectation is, as employees and colleagues and part of the LYPAFT family, we've all got responsibility to do what we can to tackle racism in our organisation and for the benefit of our service users and the wider communities that we serve. We're now rolling out the wellbeing assessment framework. We're now into the second week of that. So we'll continue to get that rolled out until every member of staff have had it in the organisation. But as you know, we're particularly wanting to make sure that all of our BAME members of staff have had those conversations because of the explicit increased risk that they face from COVID-19. And if you've not joined it before, please, every week, the Race Equality Network meets. It's open to all staff to come and share your experiences, connect with colleagues, to talk about race equality in our organisation, an individual, a team, whatever level, and what we can collectively do through creating this community to really tackle it and make a difference. If you are interested, please just email there's an email address, you'll find it on the website, for the information about the REN, or Wendy Tangen, who is the chair and the coordinator of that group, and she'll be able to send you a link to get you joined in. So another update today, and hopefully you've all seen the email that's already gone out. I mentioned this last week, and the little video clip that I did. Now you can see that my fringe needed cutting when I watched it back. That'll have to wait till the hairdresser's open. I've cut my own fringe twice already, but I'm not going to do it a third time. So we're just launching again our Your Voice Counts platform to have a conversation. So I know that we've had to do a huge amount of change in the last few months. Some of it we've got right, some of it we've not got right. Some of it might have worked for you and it might not have worked for me. And the biggest test of our organisational culture is that we want to seek feedback, to learn and to improve. We want to make people feel safe to give their feedback, and safe to contribute and be part of whatever solutions we come up with. So last year, when we used the Your Voice Counts platform to start culture conversations, we got fantastic contributions. So I'm hoping that we get the same again, but we have structured it differently this time. We've got some, the first part is to generate some quantitative data, facts and figures on some of the specific actions we've had to take around PPE, redeployment, prioritisation of services, in the early days of the pandemic, to get specific feedback. And then we want to hear your views on a number of themes and be as open and far-ranging as you want to be, but please take the time to contribute. We're going to keep it open for 3 weeks to give as much time as possible, and then as soon as we've got that data, hopefully by early August at the latest, hopefully sooner, we'll start to share some of the detailed findings from those. And they're going to help us build on some of the work that we did around the Culture Collaborative and what are the conditions that you've already identified make a big difference to what it feels like to work in this organisation. Health and wellbeing. So another focus on this, especially as we are coming up to the summer, is actually make sure you're taking the time to look after yourself in order to look after others. So this week I was asked to do the leadership blog for the West Yorkshire and Harrogate Integrated Care System. And it's a message that I've shared there in terms of, do you know what, we need to role model that none of us are immune from the challenges of what we're currently faced with. And sometimes it's tough, and sometimes we need to make sure we take a break, and we can't all be working 7 days a week, 24 hours a day, as much as we'd all like to, I'm sure. So what do we need to do? Make sure that you're taking regular breaks. It is hard. I know it's hard coming in and working in different environments, doing jobs that you might not previously have done before, working different shift patterns. If you're at home, you've got kids at home with you, you know, it's a challenge in terms of being able to concentrate. And a lot of people are just feeling guilty that, you know, they're not working in the way that they normally do, and that guilt can add to the stress and pressure that people are putting on themselves. I don't want you to do that, but that's easier said than done. So please take your breaks, take your annual leave. I'm saying the same to the executive team. I've got my annual leave planned for the summer. You might not be able to go very far other than to your local zoo, but please just make sure you take that time off. And if you want to trigger that conversation with your manager about your wellbeing assessment conversation, rather than wait for your manager to be working through, getting around everybody in the team, please just initiate it. If that's something that you feel you need to have right now, because there are things that you want to put in place and stuff that you want to have a conversation about to get the support that you need, don't wait. This isn't about waiting for somebody else to tap you on the shoulder. This is about us collectively working together. And we've got some webinars coming up this week with people talking through how to use the wellbeing assessment conversations. If you're not sure, you're worried about getting it wrong, you're not, you know, following the process correctly, not that there's a right or a wrong way of doing it, but these webinars will just talk you through it and hopefully put you at ease about what the assessments are all about. And you'll see there as well a reminder, John's on the call, he always joins every week. Our Freedom to Speak Up Guardian has continued to work throughout the pandemic, working in a flexible, adaptive way in response to what staff have needed from him. He's always there, so please contact John if there's any support that you believe he will be able to give you. So my reasons to be proud, it's quite a full one this week, which is great to see. So first of all, if you've not yet had the chance, please read the blog from Heidi, who only recently joined the Trust as our Clinical Engagement Access and Inclusion Coordinator. It's a really honest account. You know, I was sharing earlier on the challenges of working from home, having children at home. Heidi is really candid about, you know, the joys of homeschooling as a single parent with a young child, having a new job to do at the same time, and that just, you know, you can put so much pressure on yourself, can't you? So actually, hopefully read that and it'll make other people feel a bit more at ease and just normalise our own stresses and strains. We've got a huge thank you there to our amazing receptionists, and all their names are listed, who have continued to be doing a fantastic job, coming to work, just really making sure people are safely coming in and out of our buildings, signposting, and keeping all of our sites safe and secure. So thank you very much. We've got the couple of pictures here. Again, if you're on social media, you'll have seen all 8. The scarecrows that these different houses in our supported living service have been doing as a competition for Learning Disability Week. And if you have a close up at some of them, if you go onto the Twitter feed, you'll see some familiar faces if you zoom right in. And I think there's a couple there we might be able to recruit for future employment. And then we've had a couple of thank yous. So I'm going to start with the thank you that came in for the Ward 4 at the Newsom Centre. I know when you're working in inpatient services, you don't always get feedback, because often when people are in hospital and they're unwell, they want to get home and they want to get on with their lives, don't they? And that's what matters to them, and of course it is. But I've got a lovely email back in from somebody who's recently been at the Newsom Centre, and they were on the ward during the lockdown, and they just shared how much they appreciated, and they listed a whole host of staff from the ward of all the different professions, and what a difference that they made to make them feel safe. Just really personal connections and personal care. So I just wanted to share that here, because I think that's just lovely feedback, really showing at a personal level how the team there have made a difference. And plenty of examples of those across our wards that I've shared in previous weeks as well. And then I'll just finish with the thanks that came through to our bank support staff. So there's been a number of forums now that Sarge and Andrew have been doing to support our bank staff, and throughout COVID we've just really recognised that there was more we needed to do to support our bank staff, to make them feel safe, to feel supported, to get the information that they needed, which isn't the same for substantive staff in terms of accessibility to the emails that we send out and the updates that we share. And the support that we put in place to make sure that nobody suffered financial hardship as a result of COVID has been really important. So a lovely email that came back in from one of the bank staff to say thank you and what a difference it made to them. So yeah, I think that's worth shining a spotlight on as well. It's about getting it right for our service users, is hand in hand with getting it right for our staff. Nobody has any questions to ask me this week, so I've got off lightly. So I think that brings it to a close. I'll just have I know I've seen the chat box pop up a few times, so I shall have a look at that there and just pick up any final questions. John, oh, apologising you were late, but you're here. Oh, that was a private one to me. Sorry, John. Can folk who are shielding have the antibody test? That's what I said we'd have a look into, and we'll be in touch with you, Tricia, on that. Ruth, I answered your question about the app. That's entirely up to you. No one's going to check whether you've got it installed or not, but you might find it beneficial to do so. Somebody saying the email 10 days ago for the antibody test. Yeah, we've had a lot of requests come through, so we are working through it. Please bear with us. There's no impact on when you get the test. We just need to make sure we get around everybody in due course. So apologies on that one. Yes, absolutely, the test is open to our locum staff as well. Please just drop them an email. Your patients need to use face coverings. The recommendation is where you feel safe and comfortable to do so, but I also know that that's can be challenging for service users, and I know I've seen some people sharing their experiences, especially service users sadly that have experienced very traumatic events in the past. Masks themselves can be a trigger for some of that trauma, so that's very much an individual assessment for service users about what's doing right for you to keep you safe from COVID and others, but equally not causing you any significant distress from a mental health point of view. When will visitors be allowed on the ward? We are in the process of rolling out access for visitors, Paul, but what we are doing at the moment is saying please arrange visits in advance, because we can't have a load of visitors at once, because that then is too many people in a confined area and we can't maintain social distancing. So if there's somebody that you want to visit, please ring the ward, have that conversation with the ward team, and they can put a plan in place between you and the service user. I think that's it. And I'm spot on time, it's 4 o'clock. Thank you very much, everybody. It's nice to have you all join again, and hopefully I shall see you all again next week. Take care.